Hello, everyone. Welcome. I'm hoping that you are joining us. You're probably seeing us on YouTube. We are so excited you're here. My name is Ariel Zych. I'm Science Friday's Education Director, and I'm joined here by Anila. Welcome.
Hi, everyone. I'm Anila. I'm from 500 Women Scientists.
Yeah, and so Science Friday, as you know, if you're joining us through the Science Friday route, we're a public media organization. We produce the public radio show Science Friday on this afternoon. We create a whole bunch of wonderful stories about scientists, STEM professionals, books, art, epidemiology, you name it. And what we're particularly passionate about is connecting scientists and STEM professionals with all of you. We share that in common with 500 Women Scientists, which is why this Breakthrough Festival, in partnership with 500 Women Scientists, is such a boon. We've got a lot of things scheduled for you today. This is, as you know, a Connecting the Drops watch party. Connecting the Drops is one of a series of videos, the breakthrough films, that portrait women in the sciences, particularly in early career sciences, who are talking a bit about the connections between their lived experiences and their research. We will watch this video together, learn a little bit about the science and math of sneezes and respiratory droplets. We'll be taking your questions with an incredible infectious disease expert, Uché Blackstock, and we will then talk a little bit about how you can model sneezes at home without sneezing on your loved ones. It is a full sneeze festival in here, and we hope that you brought your questions and are excited for some of our science that's about to happen. Let's see.
So I'll say a little bit about 500 Women Scientists. So our mission is to serve society by making science open, inclusive, and accessible by fighting racism, patriarchy, and oppressive norms. And so we do that in multiple ways. We have local pods. You can see if you have a local pod that you want to join. We have our Gauge platform where you can literally find scientists from underrepresented backgrounds. So check out our website and see all the things that we have going on, including this festival along with Sci-Fi. All right.
And I think now we're ready to welcome our expert.
Yeah. So I'm super thrilled to introduce our expert for today. So Dr. Uché Blackstock is a board-certified emergency physician, a medical contributor for Yahoo News, as well as the founder and CEO of Advancing Health Equity, an organization that partners with healthcare organizations to address racial health disparities. Her writing has been featured in the Chicago Tribune, Scientific American, the Washington Post, and Stat News for the Boston Globe. And you can follow her on Twitter at Uché Blackstock, and I think that's going to be on the screen. And then let's welcome her to the live stream. So welcome, Dr. Uché Blackstock.
Thank you so much. I'm very excited to be here to share some of my expertise with you all and to answer some of your questions as well. I'm an emergency physician. I also do work around health equity, and I also speak on cable and broadcast news about the coronavirus pandemic. So excited to be here. Thank you.
And we are so excited to have you. I think we are already seeing folks joining the chat. If you're just joining us in YouTube, now is a great time to introduce yourself. You can start sharing your questions as we begin our video and our watch party. But we are happy to see you. Let's get the video started.
When I'm in nature, I see mathematics. The sun, the sky being blue. You see the clouds forming that contain all these droplets. Everybody's trying to capture the essence of what governs the world around us. And the best way to capture that, instead of having words, is an equation. An equation, a mathematical equation, is truly the universal language that transcends fields, transcends ideas, but also transcends cultures and countries. Bacteria, viruses, spores are transported in droplets. Knowing basically where it goes is the crux of this whole problem to understand better how diseases spread. If you look at disease transmission, it's based on humans reporting. And so the data is not the best data. But in fact, the best way to say anything is to measure it directly. My name is Lydia Boriba, and I'm a professor at MIT, Massachusetts Institute of Technology. And I do research in fundamental fluid dynamics to answer questions in disease transmission. We're trying to understand very fundamental, neglected questions that are important to control the spread of disease, but yet approaching them in a unique way through mathematics. Growing up in Algeria, we would go camping. Beaches that are quite wild. And I would watch the waves breaking for hours and look actually at the trails of the sand. Why is it doing this sound and why do we have these patterns? Growing up, what I realized was that mathematics and science was really truly universal, and that if you go in those directions early on, then you could really go anywhere after. At the PhD level, I wanted to find a way that I could give back and leverage all this knowledge and all this education to help the world. My grandmother died of tuberculosis, and some other members of the family died of tuberculosis, which is also transported in droplets. And it just hit me that epidemiology and infectious diseases was an area that really I felt very strongly about. We send people to the moon, but then we have people that don't have clear water to drink and are affected by diseases that should be eradicated by now. Droplets are really at the heart of this whole problem of transmission. Sneezes, coughs, respiratory events are probably the place, the physical aspect that we should be looking at. To record a sneeze, so sneeze, cough, or any these violent expiration events, there's a few key things that need to be put in place. The lighting, the intensity, the orientation, the angles. At the beginning, it's a bit awkward. For sneezing, we tried light sensitivity, dust, pepper. But it turns out that tickling the nose was the most universal way of getting the human subjects to sneeze. When you zoom in and you look at various parts of the clouds, look like snowflakes, and it's really beautiful. Taking an image that you can analyze precisely to extract clean enough data at high enough precision is very difficult. And image analysis becomes a critical tool. And now we can actually extract features very precisely in terms of droplet sizes, speeds, but also what actually is happening to the whole fluid. The research showed the droplets are heavy and they're going to fall very quickly, but most of them, in fact, are trapped and they're swirling around, moving. You have this momentum that dominates the earlier stage, but then this cloud has buoyancy because it is hot and moist. So if you think about hot air, it's buoyant, meaning that it's basically lighter in comparison to cold air, and therefore it's going to go up. A lighter fluid goes up and a heavier fluid goes down. And eventually when the cloud slowed down sufficiently, and you see the cloud with some angle moving upward. That's very important because most modern rooms, ventilation systems are upward. So where the cloud is sucked out to be recirculated. This problem of transmission, we find it also between plants. There was correlation between rainfalls and when the spots of infection appear in the leaves a few weeks later. You have rainfalls or irrigation on contaminated plants through the droplets that are created. Nobody actually put a camera there to actually see what happens. We basically constructed a very detailed drop tower where we had the leaf being the centerpiece and then have basically drops falling on it. We thought we would see bouncing. We never saw that. You see a contaminated drop relying completely on the motion of the leaf itself to create droplets of different signatures of sizes and distances. Therefore, the overall range of contamination around this species is this, and around that species is this. I wanted to understand if there is a true potential for droplet creation in hospitals. There are all sorts of diseases that you can get from the hospital, like Clostridium difficile. A lot more people now are dying from it. Instead of the sneezers, we just had this basically toilet flush. It was kind of an awkward setup. We use high-pressure toilet that was used in hospitals, and also high-speed cameras for this problem. There's studies that reported that sprays are coming out from flushing, but direct visualization of this to quantify exactly where it's coming from, what type of droplet size distribution, how far these things are going, it's quite shocking. When you think of the impact potentially for contamination and transmission, it's quite disturbing. But there's a lot of simple questions to be asked about, is this design of the hospitals optimized to minimize basic transmission between patients? Now we can actually start revisiting our ventilation systems and also the way that wards are designed in times of emergency when you have to put something together very quickly because you're at the front line. Ultimately, pathogens are transported in droplets. All the work that we're doing in the lab relates one way or another to how the droplets are created, whether it's from sneezing or splashes on plants or et cetera, et cetera. When I'm in nature, I see fluid dynamics and mathematics with it all the time. Science and mathematics and physics crosses all the boundaries. You find it to describe any laws of nature, and we find it also in other fields like sociology, economics. You can start seeing that all humans are connected not only through universal feelings, but through very rational ways of understanding the world around us, because mathematics is everywhere.
Awesome. I love that. I love all the different ways that we don't think about droplets from this film. So even in plant infectious diseases, droplets are meaningful and important. It's kind of one of these incredible things, especially thinking about it from a mathematical context. And that's something you know a lot about, Anila, too, right?
Yes, I saw actually that some people in the chat are from Minneapolis. I forgot to mention that I'm also a mathematician. I'm at the University of Minnesota. So thanks, Ariel.
Yeah.
So speaking of the chat, at this time we'll transition to Q&A with Dr. Blackstock. And so we have a couple of questions to get things started, but again, feel free to drop questions into the chat. So maybe I'll start with, people may not have thought about all the different STEM areas of expertise that come together to study and track COVID-19, like math shown in the video. So can you tell us a little about your work and how you work with others with different backgrounds and expertise to do your work better?
Sure. Yeah. No, so first of all, thank you so much for having me. And I think what we're seeing, especially in the pandemic in this last year, is how we do need people from many different disciplines working together to essentially end the pandemic. So some of the work that I do, it's actually a variety. I'm a clinician, so I still take care of patients with COVID-19, but I also do a lot of advocacy work around health equity, ensuring that everyone has the access to the highest potential of health, of good health. And then I also do media work, so a lot of health communications work as well. And I think what I've seen, especially in the equity work that I'm doing, is that the work of epidemiologists, of sociologists, of urban planners are all really important to thinking about how can we create healthy living conditions and situations for people, especially in the midst of the pandemic. And so I think one thing that we're seeing more of, actually, even in medical schools, is really encouraging physicians to work with the disciplines outside of medicine to understand how they can do their job better. So how can you work with people in public health, people in sociology, in urban planning, to think about a lot of these dilemmas that we really can't solve on our own without consulting folks in other disciplines.
Yeah, and a lot of what you're saying is kind of similar to what we heard on Tuesday when we were talking about tech and AI and you know how you kind of have to work with people from other fields. So that's cool to see that that's a nice theme in the sciences. Kind of pivoting away, when we talk about issues around health equity, what are we talking about exactly? And can you give our audience an introduction to this topic if it's new to them?
Sure. And so, even before the COVID-19 pandemic, there have been really significant and profound inequities in health outcomes. And what we've seen is that goes largely along racial lines. Definitely, there are these inequities that are related to socioeconomic status, but we find that even within, socioeconomic groups, income groups, that there are still racial disparities. So we know this is not just about socioeconomics, it's also about race, and more specifically racism. We know that there's no biological basis for race, it's a social construct, but we do know that the environment that it's created through systemic racism, through practices and policies, actually influences people's life opportunities, their experiences, and stressors, to the point that it also influences their health. And so, and we've seen the pandemic essentially uncover these deep structural inequities where we have Black, Latinx, and Indigenous communities being the hardest hit by the pandemic. And there was even an article that came out earlier this week. I'm not sure if you saw it in the New York Times, but the overall life expectancy for all Americans actually has gone down went down in 2020, but most profound among Black Americans by 2.7 years. And so that is really significant, right? And when we think about everyone really should have an opportunity to live their fullest and best lives, we're seeing that this is not the case. And so a lot of the work that I do around health equity is bringing attention to these issues of the social determinants of health. So thinking about how education, how jobs, how housing influence people's health. So for example, we saw that in the pandemic, we're still seeing when there's overcrowding, so when there are more than one person living in a room per house, that is a high-risk situation for being infected with coronavirus, or to perpetuate the transmission of the virus. We know that close quarters is responsible for that. So we cannot not think about housing issues or housing insecurity as separate from infectious disease issues. Like, they're one and the same. So if we're able to address housing issues, we can help actually mitigate the spread of the virus.
And can I follow up on that too? Because it's such an excellent point, and you allude to a number of different types of data that might live in different places and be collected differently in order to sort of reveal some of these patterns that signal racism in epidemiology. How are those things how is that data being collected? Is it comprehensive enough to answer these questions meaningfully, and is it being collected equitably?
Right. And Ariel, that's such a great question. And I think what we're seeing, so my twin sister, she's also a physician, and we got together. We actually wrote a piece in the Washington Post a few weeks ago because we saw the states were starting to report racial and ethnic demographic data on who was being vaccinated. And even though only 23 states were reporting, we saw these early trends that showed that Black and Latinx communities were not being vaccinated at the same rates as white Americans. But I think what that points to is how if we don't have the data, then we're not going to see the trends. And we also need complete data. While we can see some trends from partial data, we need the complete data in order to reassess, course correct, to see which communities need targeted resources or outreach. And so, one thing that we actually called for in the piece is for the Center for Disease Control to really mandate that the states are reporting this data. And what that looks like is, talking to healthcare professionals and facilities about the importance of making sure they're collecting this data, but also zip code data. We know zip code data is really important to figuring out which communities are being vaccinated.
That's such an interesting point. I had no idea that the reporting was so spotty. 23 states is not good enough. That's incredible.
Yeah, and we actually saw similar trends at the beginning of the pandemic with regards to testing and hospitalizations and deaths. And so if we don't have the data, right, we can't respond to this emergent situation in an adequate way. So it's really important that we capture that.
Oh, sure, absolutely. And I will surface this other question down here too from Nathan, asking, is it distrust or unequal access? And so, I'd love it if you could speak to that. I have my, teaser. I think I know what it is. I think it's probably both, but what is your sense of that?
Yeah, so I like to actually frame the issue, the issue around distrust more of one of institutional trustworthiness. So how can our social institutions, healthcare institutions, government, how can we really show communities that have been marginalized and exploited that in this moment, in this really scary moment, we are willing to put in the resources and the time and the effort to ensure that these communities are safe. And so I think what that looks like is making sure that we do have accessible vaccines in these neighborhoods, and not just by mass vaccination sites, because for many people, mass vaccination sites may be intimidating, especially if there's National Guard there. It depends where their home country is. They may find that traumatizing or triggering. So thinking about how can we, on a local level, have, for example, the FQHCs, the federally qualified healthcare centers, how can we also make sure that they also have vaccines? Even mobile vaccine units are important. And then even calling people in the neighborhood, having their healthcare professionals call them and say, hey, Miss So-and-so, did you get your vaccine? If not, I'm going to help you make this appointment. So bringing the vaccine to the people. And so I think what you'll see is this issue of distrust. Actually, many people have a wait and see approach where they just want to see that this vaccine is safe, that it's effective. And I think once they see that, they will change their mind. I even have my own family members and loved ones who only a few weeks ago were adamantly against getting the vaccine. And now through just patience, conversation, talking to their doctors and other loved ones, and myself, they've changed their minds to they're like, I want the vaccine now. So we need to make sure that the vaccines are accessible, that we're communicating to people what vaccines do. That's the other thing. I think a lot of people have questions about why was this vaccine developed so quickly? They're worried about material in the vaccine being incorporated into their own DNA, right? They're worried about long-term side effects. So we need to have a public health campaign that's expansive, that's culturally responsive, but that also answers people's very valid and just questions that they have about the vaccine.
Absolutely. And something you said kind of resonated with me about the people doing this work. So about that trust step, earning the trust that the communities are serving, right? And I'll kind of circle this back to the film we just watched. So Dr. Lydia Bariba started by explaining her experience with tuberculosis and how it had touched her family, and that was informing her research. How does representation and this sort of experience, like the experience that researchers bring to their work, contribute to or detract from that trust and the rollout of something like a COVID response? So where does representation fit in this picture?
Yeah, another really important question. I think representation, you always say representation is important, representation matters. I think that in this unprecedented moment, especially, I thought was important for myself as a Black physician and healthcare professional, and for my other colleagues to really be front and center in these conversations about the vaccine. I thought it was important for people in communities that look like me to see me talking about it, because as a Black woman, I represent 2% of all physicians. So many have not even seen a Black woman physician before. And I think that, I do have the perspective of a lived experience, in this country, outside of my professional role, but then I also am a physician as well, and so I understand some of the concerns. And so, yes, I think representation is important. I think that it does inform your experiences and how you do your work as well. So, just really important. And I think that question also emphasizes the need to really increase representation for diversity, in the math and sciences and in medicine. We still have such a long way to go.
No kidding. Thank you for sharing that.
Yeah, and kind of on the same side of that coin, I wanted to ask, so there have been a lot of news reports lately regarding Black women being removed from positions of power in science and technology. So what would you tell a young aspiring scientist or a doctor, engineer of color who's constantly seeing this?
I think these stories can be very demoralizing. I think we all have our stories and our experiences. But I would tell them that, one, that, it's not going to be an easy road, but you have to find people who are mentors to you, find your village of people who can help support you. Definitely engage in advocacy work around increasing representation, and then also knowing that you're never alone. While you may be alone at your own institution, definitely network and make those connections, especially with more senior people in the field who can help give you some advice about how to move forward. And I also want to just encourage people to find their own paths. That a lot of times that we have this idea of the path that we're supposed to take, but it may end up looking very, very different. But as long as it aligns with your interests, your values, your priorities, then it'll eventually all work out.
That's such good advice. I hope everyone's taking notes who's watching this. I was like perfect wisdom. So we're gonna transition a little bit from the sort of like the social around this work and get to the messy mechanical spread of disease. And I brought some safety glasses. Uché and Anila, you don't need these because you're safely on the other side of the internet. But what we're going to do is model sneezing. As I get set up, I'm actually I'm going to share with you an activity you can do in any context. So this is a sort of a riff off of Dr. Lydia Bariba's modeling and tracking of sneezes. This is a little less quantitative, a lot less quantitative, but I can show you some ways that we can model sneezing at home, make a mess, make some art, and also help others understand why sneezes are so complex and messy. So follow me. You're all going to come to my experimental setup, aka this room. I have laid a drop cloth down to create a sneeze arena, as you see. Okay, now this is important because in real life, sneezes go super far. And Dr. Blackstock, in your work, if you didn't have all of your PPE, how much distance would you put between yourself and an infected sneeze? Just asking intuitively, what's your sense of like your safest distance?
I would say indoors, you're probably not safe.
Okay.
I would probably be outside on the phone with the patient. Yeah.
That's exactly right. Well, and that's a super interesting reality that I think most of us didn't internalize until this event happened, right? So and intuitively, if someone is across from you at a desk or a cafeteria table or a bus, right, and they sneeze, you're like, okay, 4 feet, like I just don't want to get the actual like globs of snot on me. But now that we're kind of in this new world order and we've had a chance to learn about how diseases spread, particularly ones that are spread through respiratory events, we've learned it's a super long way. And that's because not all the droplets kind of make a pretty little arc, like a little projectile. They become turbulent. They become a turbulent, like little steam cloud that can get sucked up in ventilation systems. I saw a question about that in the chat. So what I've done is two things. So we're sitting on a chair. We're looking down at a track of papers. I've got a backstop because every time I do this experiment, I get paint on something I care about because I'm too enthusiastic. But we're going to use two different kinds of model sneezers. Classic spray bottle. I like the spray bottle because it gets that really fine mist Not as fine as your sneezes, folks, but very fine. And then I also go with a pipette. This is just a silly little plastic pipette that any squirter can do. You can use a turkey baster or a ketchup bottle. I like these because it kind of contains the amount of snot. I feel like this is like a good kind of approximation for sinus volume. And what I like to do, especially with kids, but actually with adults too, is I say, okay, which one of these do you think is going to be a better sneeze model? If you're watching in the chat, go ahead and tell me which of these you think might be a better way of modeling sneezes. I've color coded them. This has some blue snot. Actually, it's just water and paint in it. And then I've also got a little container with some orange. I'm just using tempera paint, because I like my carpets. And what we're going to do is actually kind of observe their path as they're squirted from our sneeze can here. Okay. This is we'll start with this sneeze and then we'll go to this one, I think. So this sneeze is kind of, like I said, the juicy version. And with kids, I say, okay, how far do you think it's going to go? How fast do we sneeze? Our sneezes come out of our noses at like hundreds of miles an hour, very, very fast, and they're volatile. And if it's a really wet one, it might look something like this. Ready, set. And sometimes I'll do a couple. I didn't aim that great on that one. So ready, set. Oh yeah, that one went really far. All right. And then I'm also going to do a blue sneeze. I see that Holly says the spray bottle she thinks will be a better fit. Holly, I kind of agree with you, but let's give it a shot. Ready, set, sneeze up. Get that sneeze out. Woo! All right. And what we have here, folks at home, I know it's a little bit far away, but what we have here now is actually a sneeze model distribution. So we have two different sneezes, one in orange. Orange is our squirter, and one in blue. And we can ask questions about each of these sneezes and say, okay, which one has more small droplets, like what we would expect from a real sneeze? I'm sorry, this is a little bit wild. Oh, it's working. You can see that. Okay. Which one has big, sticky globs of sneeze? Which one of these do you think is a better representation of a real sneeze? Okay, I'm going to go ahead and say probably the blue one. We like to spray when you accidentally sneeze on your computer monitor. There's lots of little droplets all over it that you have to wipe off, not just the big ones that land on your keyboard. But then we can ask some other cool questions. Which ones go farther, the big droplets or the little droplets? And this is really important for disease transmission, okay? So this is kind of going back to what Dr. Blackstock was talking about and what Dr. Barivo was talking about in the video. Just that those little, in my head, I'm thinking big drops, they've got a lot of mass, a lot of inertia, they're gonna go super far. But if I look at those little droplets, they go really far too. So this is our close paper. And yes, there's more little droplets on the near one. There's lots of big ones here too. But as we go out, even though they get smaller, sorry, this is a little bit messy. Even though they get smaller, those little blue droplets make it really, really far. And more of them make it really, really far. And furthermore, for all the ones that I can see there, please excuse me, there are ones that I can't see, ones that may have gotten sucked up in ventilation or in the mask of someone else, hopefully caught by some high quality PPE. I will say, if you are a mathematician, how would you describe this? And maybe Anila can help me out here. What are some other ways that you might be able to measure or quantify the sneezes that we've modeled here, besides just qualitatively, farther, not as far?
Oh, putting me on the spot. I don't know. Let's see what people think in the chat.
I see that Pablo says he thinks that the pipette will go farther and it will be more realistic. That's pretty rad. I wonder, also I'll add, super fun times is doing this with a mask as well. So masking your spray bottle. And I'm happy to do that because this is an old mask. It's a disposable one. Unfortunately, I should have brought a third color, but what I can do is turn my sheets of paper over and try this again with a mask and a fresh slate, as it were. Like this. Get our Caesar, and this time we'll put a mask up. Now this is not good mask wearing. If this were a spray bottle mask that fit correctly, it would form a nice seal around the face of the spray bottle, but we're going to use a best case approximation here. I bet you know what's going to happen. It's going to kind of be gross, but here we go. Ah! First off, that's nasty. And that's what happens when you sneeze in your mask, but your snot's not blue. And then two, if I look down, I mean, I'm sorry that this is a bit messy because it's not that absorbent, but if I look down, something different's happened. The snot's just like the blue paint, it did just fall out of the mask because it didn't get absorbed. But we don't see any of the little droplets anymore. There's like maybe a couple on there, probably just from splash, but they're not making it out. They're not making it beyond that original distance. So for those little tiny droplets, these are awesome. If you have a big sneeze fest in there, you might want to get a fresh mask just because it's maybe not the most absorbent thing. But I think it is a great way, especially with little people, to demonstrate this whole why mask wearing is important thing. Oh, Hannah, speaking to my heart, we could make a probability density function to describe the probability of a droplet making it a given distance. Rad, I totally agree. So took the probability right out of my mouth. So each of these sheets of paper, if we go back to our original, and I'm just flipping them over now. Each of these sheets of paper is essentially a bucket in a histogram. So if you had a lot of time on your hands, which we all do because we're all trapped at home, you could circle and count all of the big droplets on each of these papers. And what you would end up with is the number of droplets on each block as it spreads away from the person who sneezed. And you would be able to essentially build a histogram of droplet density from your own experiment. Rad. And you can do it with more resolution than just per page if you wanted to chunk it out. I actually love doing this experiment with measuring tape. This is not metric, so it's not science, but it's close. It's better than nothing. But you can measure it by distance and also count every inch if you wanted to get really wild and have an ultra high resolution density, like probability distribution. That'd be super rad. Kitchen pantry scientist, hi, welcome. I'd have kids compare how thick the fluids are, viscosity, and use a yardstick to measure how far the droplets went. They could make a graph. Yes. So fun ways to manipulate the viscosity of your snot. Is that a thing? Dr. Blackstock, does snot get like more or less viscous depending on how we're feeling or something? Is it variable?
I mean, it varies from person to person, but and sometimes people will say, oh, with a bacterial infection, it's usually a little bit thicker, but with both viral and bacterial infections, it could be equally as thick.
Okay, noted. So that's kind of cool. I didn't know that it varied from person to person. I always think of like, and this is probably TMI, but like how hydrated I am, or if it's like that first early morning, like when you have a cold, the mornings are the worst for some reason, and then they get like, it kind of like gets manageable over the course of the day.
Especially in the morning because you're just, you've been laying down in bed, probably the room has been dry and, you're more likely to have some, viscous mucus then. And then as you go throughout the day, you take a shower or bath, you're humidifying that mucus, you're walking around, and so it gets looser.
That's right. I think I've had that exact experience. Like try it, that's why those humidifiers are so popular during cold season.
Exactly.
Totally. Well, and so that goes like kitchen pantry scientist, totally viscosity, real. Like modify that and see if it changes the distribution of your sneezes and how far they go. I recommend. Oh, sorry. Mm-hmm.
Oh no, I was just going to say that this experiment is just so important to showing people like this idea that we have these a lot of these rules are not hard and fast. So even you could say 6 feet, stay 6 feet away from someone, that's a safe distance. But we know really the further away that you stay away from someone, the safer you are. But I love how this like simple but brilliant experiment really shows us.
Yeah, just in case we were getting a little impatient, getting a little too close. After Valentine's Day, we've gotten optimistic about our interpersonal spacing. Yeah, this is a good like I'd say party trick, but we also don't have parties. This is a good demonstration for that, showing folks what's up. I think so if other folks have questions, we can talk more about snot, or about ways that you might do this with kids or with your friends, your relatives. Please use simulated snot, not real snot. This is not something you should do with actual sneezes. Use a sprayer of some sort. You can see in the chat too that we've got links to how to do this yourself, plus links back to the original breakthrough films available. And any more questions or thoughts to kind of like take us out of our demo?
Oh, I just wanted to also say that I know some of like this week, some of the CDC guidelines came out about workplaces. And so just like sort of emphasizing the importance of paying attention to ventilation. And I feel like that really hasn't gotten a lot of discussion over the last year, but we know that coronavirus is spread in droplets, but it's also airborne. And so I think the airborne issue is something that moving forward, we're definitely going to have to pay more attention to. Absolutely.
I saw a lot of my friends, neighbors, and near persons double masking after some of the new mask recommendations. And I think that, like you said, as we kind of grow our understanding of this and what's actually working and not working, those behavior changes are going to be super important.
Right. Yeah,
yeah.
It's like we need like individual behavior changes, but we also need policy level, right? That influences buildings and ventilation and indoor dining, right?
Yeah, absolutely. And I think there's more to be had. So if you visit sciencefriday.com, we have a whole place where we like keep all of our COVID stories, including interviews with experts like Uché Blackstock, Dr. Blackstock. Thank you so much for coming. What you brought to this conversation was just outstanding. Thank you so much. And if you're wanting to kind of retroactively participate in other events from this festival, many of them you can view online after the fact. So we've had events all week long about all sorts of fun topics. Stay with us, and of course, tune into Science Friday this afternoon. I think that's it. Thank you so much.
Thank you.
Thank you.